To harvest usable body parts from aborted fetuses, there are two practical problems that need to be overcome. Number one, the abortion needs to be done in a way that the desired organs are still recoverable. And number two, the fetus needs to be alive at the time of the abortion so that the cells and tissues in the organs remain viable for experimental use. This makes partial birth abortions, where the fetus is delivered alive and in one or mostly one piece, particularly helpful for organ harvesting. But partial birth abortions are a federal crime. It is a felony to do an abortion where the fetus is delivered alive beyond certain anatomical points on the fetus, only in order to kill the fetus afterward. Yet CMP's undercover video and now forensic deposition evidence points to routine violations of this law in Planned Parenthood's abortion practice. Here's what Planned Parenthood Gulf Coast Vice President of Abortion Access, Tram Nguyen, testified under oath about her prior admissions about this topic.
Okay, this is frame 42677.
Yeah, and the quality, so again, I don't want to be crass, but the specimen quality in terms of how intact things are coming out.
There are times where it's a little too intact.
A little too intact?
Yeah, it's like, okay.
I stopped it at 43098. The question in the clip related to, from David DeLayden, related to specimen quality, and then you responded and said there are times where it's a little too intact. What did you mean when you said a little too intact?
That all of the limbs were completely attached to the torso versus the limbs being held on by a piece of tissue, piece of bone.
So when you are referring to all the limbs being attached to the torso, are you talking about a complete fetus?
Objection, vague.
It could be a fetus that has all of the limbs attached to it and the calvarium attached to it.
In the situation that you described, was the calvarium also attached?
Objection, vague.
I don't remember.
Do you remember seeing any specimens where the calvarium was also attached?
Objection, vague.
I've seen the calvarium attached to the torso, but no limbs attached, or part of the torso was missing.
Okay.
Why would an abortion provider worry about a fetus being too intact after pulling it out of the patient? The only logical answer is because they know the fetus didn't die until after it was outside the mother. They know abortions like this risk criminal liability under the partial birth abortion law. That's why Planned Parenthood has their abortion providers place so-called intent statements in their medical records to feign compliance with the federal law. The PPFA medical standards and guidelines tell the abortion provider to just mark in the patient medical record that the doctor intended to use dismemberment on the fetus. Planned Parenthood abortion providers describe this intent statement as just a routine checkbox.
So every time you do a procedure, that's how you document. So there's a checkbox that says, I intend to, so before the procedure, you do your evaluation, you write, I intend to utilize dismemberment techniques for this procedure.
Dr. Deborah Nicotola, who is in charge of developing the medical standards and guidelines, first described it this way.
Federal abortion ban is a law, and laws are up to interpretation. So there are some people who interpret it as its intent. So if I say on day one I do not intend to do this, what ultimately happens doesn't matter because I didn't intend to do this on day one, so I'm complying with the law.
You said that you can never intend to complete the procedure intact, but it does happen, is what you said on the video, right?
Objection mischaracterizes the video.
Yes.
So there are intact procedures that occur, and your understanding is that it's okay as long as the doctor signs that that wasn't the doctor's intent.
Objection.
True?
Objection, vague, mischaracterizes the video, mischaracterizes the testimony.
It is true.
Compound, sorry.
While she was Planned Parenthood National's Senior Director of Medical Services, Dr. Nicotola told Congress that neither she nor any Planned Parenthood doctor would ever perform a partial birth abortion intentionally. But here's what she finally admitted to when CMP put her under oath.
How much of a difference can that actually make if you know what's expected or what we need versus?
It makes a huge difference. I'd say a lot of people want liver, and for that reason, most providers will do this case under ultrasound guidance, so they'll know where they're putting their forceps. kind of rate-limiting step of the procedure is calvarium. Calvarium, the head is basically the biggest part. Most of the other stuff can come out intact.
Right.
It's very rare to have a patient that doesn't have enough dilation to evacuate all the other
To bring the body cavity out intact and all that.
In general, some people will actually try to change the presentation so that it's not a vertex. Because when it's a vertex presentation, you never have enough dilation at the beginning of the case unless you have a real huge amount of dilation to deliver an intact calvarium. So if you do it starting from the breech presentation, there's dilation that happens as the case goes on, and often the last you can evacuate an intact calvarium. So I mean, there are certainly steps that can be taken.
So they can
try
convert to
ensure-
breech, for example, at the start of the...
Exactly.
Excellent.
Under ultrasound guidance, they can just change the presentation.
Okay.
And we've been pretty successful with that.
Yeah.
I'd say.
Has there ever been a case where you have to change the presentation in order to get intact fetal tissue?
No.
Okay, and when you said we've been pretty successful with that, you're talking about we as in including you, correct?
Yes, including me. I worked at PPLA.
Okay.
Planned Parenthood's checkbox partial birth abortions are bad enough, but there is an even broader foundational problem of medical ethics here, with all kinds of ramifications in state and federal law. Planned Parenthood promised its patients, and the patients trusted Planned Parenthood, to make decisions on the patient's care based on the best medical interest of the patient. Instead, secretly, Planned Parenthood changed the way they treated their patients in order to get marketable body parts.
And then at the PPLA time, so we'll go to PPLA time, with that fetal tissue procurement, would the surgeon in any way change the abortion procedure for those patients who had consented to donate fetal tissue?
Objection, vague, calls for speculation. You can answer. Not the procedure.
Okay. And when you say not the procedure, would the surgeon change anything besides the procedure for those patients who had agreed to provide fetal tissue?
Not the procedure, which is the abortion. Not the method, which is aspiration abortion. The techniques, sometimes there was a just lively discussion about whether it was permitted or not permitted to change the technique. And we were still debating that in Los Angeles when I left, but by the time I met Mr. DeLayden and his associates, I had evolved in my thinking to think that changing the technique to get better tissue was allowed.
Okay. So, and I want to make sure we unpack that so we're all clear. So when you say the procedure, because you said three things: procedure, method, technique.
Right.
Would you describe for us what is your understanding of the meaning of the word procedure?
An abortion.
You had said that your thinking had evolved on changes in techniques. If you could tell me, when did your thinking begin to evolve on changing of techniques that you had referenced earlier?
Sometime, evolution is a process, as we know. I would say that when I was at PPLA, there was question marks about whether it was permissible to obtain tissue by using different techniques, because the legal regulations were not at all clear, and nor did they define things. By the time I was at PP Pasadena, many of us were moving in the direction of making this distinction between method and procedure and the method and technique. And so I was very comfortable at that time that the difference in technique doing a different technique, say aspiration versus manual aspiration versus electronic aspiration, did not really affect the procedure or the method, so was therefore permissible in terms of fetal tissue donation.
The problem with this tap dance? The law says no changes in the procedures, plural, used to terminate a pregnancy, the actual steps taken, not the procedure as a singular abstract concept. And the Planned Parenthood consent form? It promised the patients that nothing would change in the way they were treated. Planned Parenthood lies to their vulnerable patients, to government officials, and to the public who pays taxes to prop them up. It's time for them to face justice under the law.